Hey guys, it's Dr. Matt Sherwood here again with Sherwood Spine and Sport in Crown Point, Indiana. So we're gonna continue our video series on low back pain with sciatica. So this is our second video. If you recall from the first video, I had said that the three most common causes for sciatic I see in my office are a lumbar disc herniation that makes contact with the nerve in the low back, arthritis causing irritation of the nerve or pinching the nerve in the low back, excuse me, or the sciatic nerve getting compressed in the back of the hip, which I would call a true sciatica because it's actually involving the sciatic nerve itself. So what we're gonna do in the video today is we're gonna go over the disc herniation scenario, and we're gonna go over how that presents, things that you shouldn't be doing if you feel like you have those kind of symptoms or that situation going on, and then also some exercises at home you can try doing to start to heal yourselves. So I first wanted to go over what actually is a disc herniation. So discs, if you are not familiar, these are two vertebrae in the lumbar spine, we'll just say. So we have bone, the disc is the soft structure in the middle. The yellow here is our nerve. On this side, the nerve runs through a little tunnel called a foramen, and then in the lumbar spine, that will go down into the leg. So what happens over time is the outer lining of this disc, which is called the annulus, will get little tears in it. And even though the pain usually starts immediately, it usually happens slowly over time, and there's one episode that just kind of pushes it over the edge. You could sneeze too hard, bend and pick something up, so on and so forth. So what will happen, you'll get little tears, and then the jelly structure in the middle of the disc is called a nucleus, and that will actually escape through the tears and create a bulge. So what actually happens on this model here, oh, got the wrong side, is that will bulge like this, and then it will make contact with the nerve. It usually goes to one side or the other. It could be on both sides, and that will go down the leg and give you your sciatic-like symptoms, okay? So usually how these present is the pain will be radiating across the base of the lower back like a belt. It will usually be worse when you bend forward, and it will be worse when you sit. Now, it's important to note that we're not dealing with absolutes here, so there's exceptions to the rule, but generally that's the most common presentation. So it's pain when you sit, pain bending forward, pain is much worse in the morning getting out of bed, and it's usually actually relieved when you're up standing and walking. So those are very characteristic. So if you feel like that kind of fits your pattern, you might have this situation going on here. So what kind of things do we absolutely want to avoid doing this? Well, even though it hurts when you bend forward, people think that they should continually stretch forward because they think they're gonna work something out. That's actually what you wanna completely avoid doing. So you should not be doing any forward bending stretches trying to touch your toes, no sitting on the butt trying to touch your toes, no child's pose thing. So anything where the back is being rounded more, you wanna temporarily avoid doing that. And instead we wanna really limit how much we're sitting. So you can sit a little bit, but then get up every 20 minutes or so at least. You can take walks a lot, lay on your back, just change positions frequently. Yeah, and absolutely no bending forward for the time being. So that's the most important thing to start with, the point I want to hit home here. And then I also want to go through just probably two big important exercises that you guys can start doing. So we'll do that now. All right, guys, the first exercise you should be doing, which I feel is the most important, we call it a prone press up. It's also called a cobra if you're familiar with yoga, but instead of holding the position, we're gonna do repetitions of them. And I will usually have my patients start with 10 to 15 repetitions of this every 3 hours. Sometimes as often as every hour, depending on how bad the pain is. So how we're doing this is we're just starting flat on our stomach. We're using our arms to push up. We're not using the back muscles. That's very important. Should be very passive on the back. We go up high as we can. Take a long breath out. Wait for the back to sag. We go back down to the ground, and then we do 10 to 15 of those in a row. Should only take a few minutes. One important thing to note, if the pain is getting worse going down the leg as you're doing that, you should immediately stop doing that and then consult with someone right away, because that could be a worsening of it. That exercise will not work for you. Sometimes it also needs to be tweaked a little bit. The pain should either be right in the center of the spine, like a thumb right in the middle, or it should be, the pain should go away completely as you're doing those. So that's an important one to keep in mind. And then I'll show you this other exercise coming up next here. All right, now let's say we can't always lie on the ground. That's pretty reasonable, right? So we have jobs, we can't just, hit the deck, lay on the floor and do a bunch of press ups. So an alternative to that, although I don't think it works quite as well, but these are just called standing back bends. So you're just putting the hands across the base of the lower back, keeping back muscles relaxed. You're leaning back far as possible, coming back up straight. And then we're gonna do 5 of those in a row as far as you can every hour. The same rule applies with those. So if you're feeling the pain directly in the center of the spine, just like a thumb pushed in there or nothing, you're good to go. If the pain's worsening across the lower back like a belt, or it's going down the leg worse, then you would stop that immediately. And that concludes our video on the low back pain with sciatica caused by a low back or a lumbar disc herniation. Hope you guys enjoyed that. Hope you took something out of it. Any questions or anything, please comment below.